I'm not surprised at all that Calvin has risen to become a brigadier general in the Air Force Guard. I had the pleasure of going to his pinning ceremony, and the room was full. And it was full because of the number of people that respect Calvin as a person. And it was full because he exhibits quality leadership. And leadership to the armed forces, leadership to the community, leadership in his church, leadership in Palmetto Health. We're in the presence of a true leader. CEOs and board chairmen spend a lot of time together, and so it's a wonderful experience to be able to spend time with a person of such integrity, first of all. Secondly, he is always interested in how well we're doing, how well we are touching the lives of other people. He's a continual learner, but he's also a continual server. And so it's easy to have Calvin participate, whether it's at the AHA level, national level, whether it's at state level through the South Carolina Hospital Association board and related committees, or whether it's locally in our own community.
He has such a keen understanding of hospital health care in general, nationally. He is very active in attending the various local, national healthcare educational programs and bringing that back to the board. He's such a people person, and he is so easy to talk with. He's always willing to be an advisor to individuals who are less experienced board members, and I think that's very valuable to all of us who've come behind him.
He is an informed, committed, compassionate leader, and he is constantly educating himself to keep up with the ever-changing healthcare system. Because he is informed, he can bring others on board, and he, as I said, he's open-minded and he will listen to all viewpoints. But because he has the background, he can stand for what he knows is right and what he believes is the appropriate response, and he can encourage others in a non-threatening way to join him.
Calvin changed us. He was a major driver in the development of the quality blueprint. He was so involved in the development of this, and I think his legacy is going to be the quality of care that we provide, and not just during his tenure, but it persists now, even as we're developing more reliable ways to deliver higher quality care. Calvin's fingerprints are on those.
Dr. Floyd epitomizes what a good hospital trustee should be. You need to know the field. You need to be very interested in the field. You also need to not just have your opinion. You need to corral opinions and be able to work with the board collaboratively. And he has that ability. He's a consensus builder. He is a visionary.
It seems to me that the chairman of board of trustee of hospital pretty much lives in a world in which there's a nexus between the community and between politics and between medicine and between administration. Wonderful thing about Eddie Floyd is he's simply not knowledgeable about all those things. He's a player in each of those dimensions.
He is a champion for Carolinas. He loves this hospital. The hospital wouldn't be standing here today if it wasn't for him. His efforts and his dedication really brought about the building of Carolinas back in the mid to late 90s, and he has been just a stalwart of this hospital, growing it and being a champion for any cause that the hospital had over the last 15 years. And one of the things that was born out of the building of Carolinas was the formation of the Bruce and Lee Foundation here in Florence, and Dr. Floyd serves on the board of the Bruce and Lee Foundation as well, and that foundation has done such tremendous things for Florence, and building the library and the Performing Arts Center, and now building the museum that they're currently building, and all those projects wouldn't have happened without not only the development of Carolinas, but the development of the Bruce and Lee Foundation that Dr. Floyd plays such an integral part in.
He's devoted his life to medical care for this community, which means seeing that people who live here have a better quality of life, taking care of their health, supplying great medical care to the community, taking care of their needs.
Eddie Floyd is more than simply a leader in Florence. He's an individual who's had a very pervasive and persuasive influence on public policy in South Carolina for decades.
His influence goes beyond our area, goes beyond our state. Actually, when he served on the big board up in New York, great influence there. He also served as a United Nations delegate. Tell me how many people from a little town like Florence, South Carolina, has the great opportunity to do that. Not many.
You can't mention Carolina's hospital system and not think of Dr. Eddie Floyd.
Whether he's physically here or not, Eddie Floyd's spirit will always dominate what this hospital represents in this community.